Yeah.
A very warm welcome to everyone. I'm your host, Dr. Shumayou Dutta, and today I'll share some exercises to help you make your back the pillar of your strength. Now, as a spine surgeon, I'm always treating back and neck pain, and in more cases than not, it's due to muscular imbalances, it's due to a poor lifestyle, it's due to contractures around the joints, a sitting job, lack of exercise. So, today we're going to focus on what you can do in the form of exercises to make your back strong again. And this is typically designed for those who've never exercised, or for those who've been exercising and doing only strength training and haven't focused on stretching and the other aspects. For someone who's post-operative and is just recovering and now it's time to start strengthening the back. So we have a fitness celebrity trainer, Neeraj with us, who will be demonstrating the exercises. So instead of taking too much of time, I'll get straight to it. These exercises have been divided up into 4 phases, each phase lasting 3 to 6 weeks. Needless to say, you should get cleared from your spine surgeon before you do these exercises. And let's get straight to it. So this is the first exercise. It's a partial straight leg deadlift. So then you lie down. All these are mat exercises. So you lie down, and with your knee straight, you lift it up. You lift your lower leg up 6 to 8 inches off the floor. You can hold it there for a few seconds if you can, or you can keep doing it. The aim is to do 50 reps, and you can break it up as you wish. You can do 5 sets of 10, or you can do 50 at a go if you're feeling strong and it's not hurting. Mind you, you may experience some pain after you do these exercises, but pain is normal and it's good. But if it's out of proportion and disproportionate to the amount of exercise, then you may want to get checked out. Your breathing is very important through all of these exercises. So when you're doing it, don't hold your breath. Breathe normally. Don't rush through the exercise. Take it nice and easy. And feel the core contract. So when you're doing these exercises, you can see Neeraj's core contracting. And a simple way to know your core is contracting is you should imagine your belly button move towards your spine when you're doing the exercise. So after about 50 of these, we move to the next exercise. And in this, you're lying down. So these exercises are a mixture of strength training, where you're training to increase the strength of your back, your core muscles. There are also some stretches to increase the mobility around the hip, and there's some mobility exercises. So this is an exercise for your hip and your spine mobility. So with your feet, you're lying down with your feet shoulder width apart. Just drop it to one side and then drop it to the other side. So you do this about 50 times. Don't rush through it. Feel the stretch in your back. Feel the hip moving. Feel the spine moving. Try to keep your upper body straight. But if it's difficult in the beginning, then you can move your upper body also. So in the second variation of this, now you put the feet together, and when you do so, the movement goes entirely onto the lower back, and it's not an exercise for the hip anymore. So here you're moving your legs to one side and then the other side, feeling the stretch in the lower back. This is generally a very comforting exercise, and you do 100 of these. Now the third exercise, this is a strength training exercise. So in this exercise, you're lying down, you flex your knees a little bit until you get into this position, and your aim is to build the back extensors up a little bit. So you lift it, it's called a pelvic bridge. The knee, the pelvis, and the shoulder should come into the same line. And once you do this, once you're into this position, you hold it for about 5 minutes or 5 seconds, and then you slowly let go. I'll remind you again, breathe continuously through the exercise. Don't hold your breath. You should feel a good strength contraction. You shouldn't feel too much of pain. And if you're doing it and you're comfortable, then keep doing it. You should aim around 50 of those. And this is another variation for the back extension exercise. So you move on to this, you turn on to your stomach. Now you're lying down, face down. And what we want to do is we want to focus on different aspects of the back. To understand the back, it's not an isolated body part. The back is connected to the hip, which is connected to the knees. The back is also connected to the scapula, connected to the shoulder and the upper body. So you can't just isolate train it. You need to train, strength train, everything involved. So in this exercise, we'll be working out the upper back, the scapular muscles, and then slowly into the hips also. So first, you do this 5 reps each. So 5 times everything remains nice and loose, but one arm is lifted straight up above the bed. So that's the second. You do the second, the left arm now, and do it 5 times again. And after you finished 5 of the left arm, now move on to the left leg or the right leg, and you keep the knee straight and lift it up as much as you can. You should feel some contraction in your buttock. You should feel a good pain in your lower back. And then after 5 reps of the same, you move on to the fourth leg.
Shoot another video for it too.
So after you finished 1 round of 5 repetitions each, you do the same 5 times. So you're doing 25 of each.
Okay. Great.
So far we've done some mobility exercises for the lower back. We've done some strengthening for the core. We've done some strengthening for the back extensors. And the last exercise is a stretch based exercise. So in this, you're lying down on your back and you want to feel a nice stretch in the posterior chain, in the hamstrings, in the buttock, in the lower back when you do it. So you clasp your knees with both your hands and you pull it towards your chest. Hold it there for 5 seconds and then open up your arms till it comes back into the neutral position. And once you do so, that's the 1 rep. You do 50 of such reps.
Keep doing it.
It's better to do it 1 leg at a time and work your way up. So in this you can see Neeraj has pulled his knee towards his chest and he's choosing to do it. You can do it on the same side. You can pull your knee to the opposite side also. So you can see here, he's pulling the knee across on towards the opposite shoulder. So this adds a little bit of stretch onto the bottom. But to begin with, you can pull it towards the same shoulder and slowly work your way across to the opposite shoulder. So this completes the session. You should take about maybe 25 minutes to do it. They need to be done daily, every single day. There's no specific time. You can get up anytime in the day. You have some time, just get down to it and get it done. These are all strength, mobility and stretch based exercise, but this is just a very small part of your fitness. If you want to get your back pain away, or if you want to rehabilitate yourself into a stronger spine, then you need to also go for 45 minutes of aerobic exercise, which is something simple like walking, brisk walking, 45 minutes at a stretch. So the exercise plus 45 minutes of walking should be your basic exercise for the next 3 to 4 weeks. So if you're cleared from your surgeon to start your exercises, you can go to a physical therapist and learn the exercises, or you could see this and do it. This is not professional advice. This is just guidance. You should do your own due diligence, get professional advice from your own healthcare professional and do it accordingly. So if you're doing this and you're feeling good, your back is feeling strong, you continue it for the next 4 weeks, and after that you can move on to the next set of exercises, which will be slightly more challenging than this, and gradually work your way up. I hope this has been helpful. This is a new initiative where we try to reach out to patients and increase the quality of care available, and this I found to be a very convenient. If you do like it, please do subscribe and leave a like. Thank you so much.
Yeah.